What can lab tests tell you about your mental health? My name is Dr. Ruth Thoughton. I'm a board-certified adult psychiatrist and a metabolic psychiatrist, meaning that I look at the overlap between metabolic health and mental health. And looking at labs is a very useful way to tell if there might be issues going on, like inflammation, insulin resistance, and vitamin deficiencies. So in a recent video, I posted about the different ways that I can tell if someone has metabolic dysfunction that might be contributing to their mental health symptoms. And one of the questions that I was asked was, can you go through the labs and talk about what's normal and what's abnormal? So this is going to be a little dense, but I'm going to do that for you, okay? And if you have your recent lab tests, you can pull them up and use what I'm talking about today to help you. So first, we're going to talk about your comprehensive metabolic panel. This is going to look at your kidney function, your liver function, and your electrolytes. So we're going to see if there's electrolyte abnormalities, things like sodium, chloride, potassium. We're going to see if there's kidney dysfunction. So if your creatinine is high or your estimated glomerular filtration rate, or eGFR, is low, that indicates some dysfunction in the kidneys. And then with your liver, we're going to look at the liver enzymes, AST and ALT. And if these are high, then it indicates that there's some inflammation of the liver or some process going on there. Now, there are other tests we can run to look for liver dysfunction, but this is kind of an initial screen. Then you're going to have your comprehensive blood count. And so this is going to look at the levels of your hematocrit, your hemoglobin, your platelets, your white blood cells, etc. And so what we're primarily looking for in terms of mental health is there anemia, which would be indicated by low hemoglobin and hematocrit. And we can also tell a little bit of something about what the cause of that anemia might be by looking at other measures that show the size and shape of the cell. Then we're going to look at your lipid panel. So this is going to show us your HDL, which is your good cholesterol, your LDL, which is your bad cholesterol, and your triglycerides, which is kind of a proxy for your blood sugar level. Now, I've done more extensive videos on this topic, but I'll kind of run through it really quickly here. So in general, the cutoffs for a normal triglyceride level are going to be too high. So they're going to say that 150 or less is normal, but we really want to be shooting for a level less than 100. And for HDL, it's going to say that normal is over 45 in men and over 55 in women, but really the higher the better. I want to see levels at least 60, 70. And then for your LDL, well, I'll just say that your doctor probably puts too much emphasis on this value. It's not that it's not important, it's just that it's not the most useful measure of cardiovascular dysfunction. Another helpful thing we can tell from the lipid panel is your triglyceride to HDL ratio. So if this ratio is greater than 1.5, then it indicates that you likely have insulin resistance, which brings me to my next point, which is the hemoglobin A1C. This is a measure of your average blood sugar over the last 3 months. So if it's a level of 5.6 or less, that's technically normal. 5.7 to 6.5 is in the pre-diabetes range, and then greater than 6.5 is concerning for diabetes, although not diagnostic. Now, the thing is that by the time your blood sugar is abnormal, so this level would be high, you've probably had insulin resistance for a long time. So other screening measures like the triglyceride to HDL ratio and some others that I've talked about in other videos are a better way to screen for this condition. So then we're going to look at vitamins. As far as vitamin D, your lab test is going to show that anything greater than 30 is normal. But we really know that for optimal brain health, we want your levels to be 50 or greater. Folate levels are pretty straightforward. You want them to be over 3. Vitamin B12 is a little more similar to vitamin D in that our cutoffs are probably too low. So the cutoffs are going to be anything over 200 to 250 is going to be considered normal. But often in these cases, when we look at functional vitamin B12 tests like homocysteine and methylmalonic acid, these tests are going to show that even though that level is normal, it's not enough for your cells to function properly. However, unfortunately, these tests are often not covered by insurance or they're pretty expensive. So I generally just recommend that if you're in that borderline level, to supplement or to make changes in your diet. So I want people's vitamin B12 to be at least 400. And then lastly is ferritin. This is a proxy for your iron stores. And of course, iron deficiency can cause anemia, which can cause mental health symptoms. So again, similar to a lot of these lab tests, it's going to show that anything greater than 30 for men or 13 for women is normal. But we really want to be shooting for higher numbers, things like 60 to 70 or greater, in order to, again, have optimal brain health. And there can be other things that affect your ferritin levels. So if it's a little unclear, getting an iron panel can be helpful as well. We're also going to check for a thyroid stimulating hormone. So if this level is low, meaning less than 0.5, that's indicating overactive thyroid. And if it's high, meaning greater than 5, this is going to be indicative of underactive thyroid. So if it's abnormal, we're probably going to order some additional tests like a free T4 of T3, and then maybe thyroid antibodies to check if there's an autoimmune issue going on. And then I talked about using CRP and ESR as markers of inflammation. So if these are elevated, that indicates inflammation. However, there are lots of different things that can cause this elevation and inflammation. So it's kind of non-specific. And so it could indicate a lot of things, but at the very least, we know there's some inflammation going on. Okay, so I know that was a lot of information. If you've had experiences where some lab abnormalities have been found and been addressed, and you've noticed an improvement in your mental health symptoms, I'd love to hear about it. Please share in the comments below. Wishing you all good mental health today, and I'll see you in the next one.